Wondering if that rash down there is something you need to worry about? How did you get it? Is it contagious? How do you treat it? You may be too embarrassed to bring it up with your doctor, but guess what? Dermatologists, we have seen and heard it all. You are not going to shock us or surprise us, I promise. And we really, really, really want you to tell us about your skin concerns because we are the experts, skin, hair, and nails, and we can help you treat these problems that you have. So don't be too embarrassed to ask us, but I understand we're all human. If you have ever had a skin concern that you were a little bit embarrassed to ask, this episode is for you. I'm Dr. Mary Alice Mina, and welcome to my channel, The Skin Real, where I give people real skin education and guidance so that they can make informed decisions about their skin health. Sound good? Let's dive in. Welcome to my weekly recap episode where I break down my key takeaways from my most recent episode with Dr. Shannon Trotter. And I love this episode. I had so much fun doing it because we were covering some of the top 5 questions that we get from patients that are really embarrassing. And we get it. People don't want to admit they have a rash in the genitals. They're scared that maybe it's a sexually transmitted infection. They're worried that maybe they're going to give it to their partner or how did they get it? And fear not, we are here to help. Other things we see commonly, toe fungus, or maybe you got that tattoo on spring break that you're kind of regretting you didn't get. So we have seen and heard it all, and you are not going to shock us. So I just encourage you to ask us and show your doctor, tell your doctor if you have a concern. Don't be embarrassed. That is why we are here. And that's why we also hold ourselves to really high standards for patient privacy, because we know sharing with us your intimate personal history, your health is not easy. And that's why that doctor-physician relationship is so important. So let's dive in. And if you want to hear the full episode with Dr. Trotter, I highly encourage you to check it out. I'm going to link it at the end of this video. So I know with the skin, it's so visible. And if you get a rash or you have a skin concern, a lot of times other people see it, they notice it. Maybe someone even brought it to your attention. Say something like body odor. Maybe you didn't think you smelled. Maybe you have a nose like I do, which is not super attuned. And someone has to tell you, I think you kind of smell a little bit. That can be embarrassing for sure, and nobody wants to hear that. But don't be afraid to talk to your doctor, your dermatologist about this, because there are things that can be done. So the first thing we tackled in this episode was an odor, especially an odor down there. Now, women can experience this, men can experience this. Really, it doesn't discriminate, but I do find that women tend to be a little more attuned to it. And that's because for women, we have complex microbiome down there with mucosal tissue and hormone changes. And so sometimes there can be an odor. And first of all, it's natural for our bodies to have an odor. So that's number one. Everyone has an odor of some sort. But now if you find that it's especially strong, we want to make sure we rule out things like an infection, because certainly an infection can cause an odor in this area. We want to make sure there's not a medical cause for that. Once those have been sort of ruled out, just know that our sweat, when it mixes with bacteria on our skin, can cause an odor. That is why we use antiperspirants or deodorants under our arms. Things like wearing tight-fitting clothing. Yeah, this whole athleisure look where people wear yoga pants all around, all day, every day, tight-fitting clothes, that can exacerbate body odor, especially if you are sweating, live in a hot climate, it's very humid. So if you are going to be working out, exercising, wearing tight-fitting clothes, make sure you shower, rinse off that sweat from your body to help prevent the odor. Now, there are body deodorants out there, and they do work. So the way deodorants work is that they actually mask the smell. So unlike antiperspirants, which actually prevent you from sweating, these deodorants, you rub them on the skin, and they either replace your natural body odor with a fragrance or a different smell, or they neutralize it completely so that it is unscented. And you can choose whichever one you prefer, but if you listen to my podcast, you know I'm not a super big fan of fragrances only because it can cause allergic reactions. And you certainly don't want to be replacing your body odor with a terrible rash, especially in sensitive areas. So my recommendation, if you're going to be using a body odor, especially one with a fragrance, is do a little test spot. Don't use it on your whole body. Test it, maybe the inner part of your arm, just to make sure you don't get a rash before you start using it in areas that may have an odor, like under the breast or in the groin area or areas where you have skin folds. Another way to minimize body odor is to decrease the amount of sweat. So again, rinsing off after you exercise or work out, making sure you let these areas dry out after a shower. Sometimes people even use like a hair dryer to really dry out the area. You could use little powders that help absorb moisture. You can even use things like antiperspirants in the area that help prevent sweating, and other things like botulinum toxin, so Botox. This is injected into the skin and it helps prevent sweating as well. So lots of things that can be done if you do have body odor, from body deodorants to antiperspirants to preventing sweating, and also just hygiene things like washing off. Benzoyl peroxide in the shower can also be a great option to help remove bacteria on the skin, which is going to mix with our sweat and cause odor. So don't be afraid if you've got a little bit of a body odor. Don't be embarrassed. Talk to your doctor, talk to your dermatologist about ways to help that. Number 2, we talked about is a rash in the groin area. And I find this can be really scary for patients to have a rash there. It can be super uncomfortable. The skin in our genital area, it tends to be thinner and can really be tender and painful when you have a rash there, swelling, itching, all of that stuff. So first and foremost, we need to figure out what is this rash caused by. And even things like psoriasis can actually be in the genital area. Eczema can be in the genital area. Again, it's just irritation from sweat and bacteria where the skin is just coming into contact with each other. There can be some chafing and rubbing. Sometimes just the skin rubbing against each other, something we call intertrigo. And the skin here, it's moist, it's warm, it can be a breeding ground for bacteria and yeast. So sometimes just drying out that area, protecting the skin barrier can be really impactful. Think of intertrigo as kind of like diaper rash in babies, where they have that skin on skin, those cute, adorable baby folds that are rubbing together, especially if there is a little bit of irritation from urine or feces, which is typically not a problem in adults, but can be a problem for elderly or people who are less mobile, who maybe have some incontinence issues. This can happen as well. Sometimes things like psoriasis, even though it looks more orangey yellow on the skin and flaky, when it's in the genital areas, it can look totally different, again, because you have that skin-on-skin contact. So you don't have that flaky scaliness that you do in other parts of the body. So it can be tricky to know what that is. Now, sometimes I will do a biopsy of a rash in this area because there can be certain skin cancers that can cause these rashes. Things like mycosis fungoides or extramammary Paget's disease. So those are things we don't want to miss, and biopsy can be helpful if it's not responding to other treatments. So this is why having your dermatologist take a look at it can be really important. And I know a lot of people are really worried about sexually transmitted infections, and they worry that a rash in that area could be a sign of that. And so again, your dermatologist is going to be trained in assessing those kinds of rashes. You certainly can get rashes that are sexually transmitted. So again, don't be embarrassed to show your dermatologist. Let us take a look at it, because not only can we make a diagnosis, but we can also help you either get rid of it or treat it and make sure it's nothing bad or dangerous. Another topic we talked about was sweating. We're kind of on this this theme of sweating. That can be very embarrassing for patients. And you may think, oh, I sweat a lot at the gym, I have to shower afterwards. But there's some people who sweat even just day to day. Their sweat is so bad they have to keep a handkerchief in their pocket, because if they go to shake someone's hand, their hand will be totally covered with sweat. And you can imagine that can really affect someone in business and in life. If their hand is so sweaty, they're afraid to shake hands, that can really impact their ability to make a living and their success in their job and their work, or with romantic relationships and things like that. So Sweating, over sweating, it's something we call hyperhidrosis. Don't be embarrassed by this. There are some things we can do to help. We talked earlier about using botulinum toxin. This isn't really an option if it's all over, but if it's areas like your hands, your feet, your armpits, we can inject it. That can be helpful. There also are some procedures and devices like Miradry or something called iontophoresis that can help with sweating. And there are topical products that you can rub on your hands. Things like aluminum chloride, which is like an antiperspirant, can help prevent sweating. And there are even pills that you can take to help prevent that excess swelling, that cholinergic response, and they can be helpful. So again, sweating, yes, you may be wondering, I don't even know who to talk to about this, but that is definitely something your dermatologist can help you with. So don't be embarrassed. Don't be afraid to talk to us about that. The fourth thing we talked about was toe fungus. And I feel like in certain people and age groups, I almost expect to see toe fungus. It's super, super common. In fact, when I don't see it in someone who is maybe 80 plus, it's a little bit surprising because it's something I see so commonly. Toe fungus, it's all around us. You put yourself at higher risk of getting toe fungus by walking around barefoot in public places, the pool, the gym. So really my recommendation is to wear shower shoes, wear slippers, wear things so you are not walking around barefoot, especially in public places where you can get toe fungus. You also want to let your toes air out. If you wear socks all day, especially if your feet get sweaty and the socks get a little bit wet, this can be a breeding ground for toe fungus. So when you get home, go ahead, take off those wet socks, take off those stinky shoes, let your feet air out. You may want to put like an antifungal powder in your shoes or socks if you're prone to sweating. But toe fungus, the first thing is to make sure it really is toe fungus. I had a patient who was treated for toe fungus for years. And guess what? It was actually a squamous cell carcinoma of the toenail. So we want to make sure it is, in fact, fungus and not something else, especially something dangerous like a squamous cell carcinoma of the skin. So a lot of times your dermatologist will do a little clipping, a toenail clipping, where they cut a piece off, they send it to the lab just to verify it is toe fungus. Now, toe fungus can be incredibly difficult to treat because even when we get clearance, not always does the toenail go back to totally normal looking, even though there's no more fungus in it. And also, it's super easy to reinfect yourself. So this can be a bit of a frustrating process with the toes. Now, there have been reports showing that Vicks Vapor Rub, when rubbed on toenails, can actually prevent or treat toe fungus. Another common one would be using this toenail polish, like this little lacquer that you can rub on the toes. That can help in some people. But really, the mainstay treatment for toe fungus is to take an oral antifungal medication. The problem with this is that you have to take it for weeks at a time, and it can be damaging to your liver. So your dermatologist may actually order a check of your liver through a blood test before starting and maybe midway through treatment. And sometimes we actually pulse the treatments. Now, cure rates are not amazing when we use it, even with the oral medication. And like I said, even when we have total clearance of the fungus based on like another toenail clipping, the toes can still look a little bit funky and different. So toe fungus is really common. There are some things we can try, but just know there's not always a slam dunk in the treatment of toe fungus. Really, your best bet is to try to prevent getting it in the first place, and then see your dermatologist to try some of these options. Lastly, I want to talk about tattooing. And I shared this on the episode I did with Dr. Trotter, but I actually had a tattoo when I was younger. I was 18. I thought it was really cool at the time, and it was on my lower back. And I loved it for about a year until people started referring to tattoos on the lower back as tramp stamp. And I thought, oh my goodness, I do not want this. I've made a mistake. And I went to talk to a dermatologist about getting removed, but it was so expensive and I didn't have the money at the time. So I had to live with it. But I ended up going into dermatology, and during my residency, I had access to tattoo lasers. And so I slowly, over my dermatology residency, had people laser it to remove it. So if you have a tattoo that you decide you really don't want it to be forever, there are treatments for that. But it can take time, it can be lengthy, and it's expensive, especially with using these lasers. Now, a couple things to be aware of. When you get these, especially professional tattoos, they are depositing the pigment deep into your dermis, into your skin. And so doing these more superficial procedures like dermabrating it, rubbing it off, applying topical things to the skin really aren't going to get deep enough to reach that pigment from a professional tattoo. Now, if you have a tattoo you did with your friends or like a prison tattoo, something like that, those are more superficial. They're not professional, and the ink may be higher in the skin. But again, I wouldn't recommend these procedures that just abrade the top layers of your skin because you're going to get potentially scarring. It's going to be very traumatic to your skin barrier, and you're probably not going to go deep enough to get that tattoo pigment. Really, the gold standard for removing tattoos is with lasers that are designed to go deep and target that pigment. Now, that blue-black classic tattoo pigment, that's going to be the easiest one to remove. But some other pigments, whites and yellows, oranges and reds, those can be a little bit trickier. So I would recommend seeing someone who is a laser expert, especially if you've got those colors or if you have darker skin. There are a lot of like tattoo pop-up places around, but if you have darker skin or some of those other colors, really see a laser expert because you can damage your skin. You can get lightening of the skin. You can even get reactions when this is not done by someone who's really well trained. And I have really light skin, and even getting my tattoo removed, I still have some whiteness where the tattoo was. So you can only imagine. And it's harder to see because my skin is so light to begin with. But if I had darker skin, that would be fairly noticeable. And while the tattoo ink may be gone, you can kind of still see the tattoo because of that whiteness or that lightening of the skin where it was. So seek an expert to help remove your tattoo. It is unfortunately expensive. It does take multiple treatments. But if you really want that tattoo gone, that's going to be your best bet. The other option would be if it's very small. If it's small or an area where you have some looser skin, I have cut out some tattoos for people, but just know you're trading that tattoo for a scar. But a lot of times it can blend nicely depending on where the tattoo is, how much loose skin you have, what we call skin laxity. And for some people, I've been able to very successfully remove a small tattoo, stitch it up, and they have a thin little scar that kind of disappears and fades. Tattoo is gone and they're happy. So those are really your best bets for tattoo removal. I really love this episode with Dr. Trotter because I feel like these are common things that people have questions on, but they can be a little bit embarrassing to discuss. So just know that is why your dermatologist is there to help you with these issues. We are the experts in skin, hair, and nails. So if you have any of these concerns, talk to your dermatologist. We've seen it all. We've heard it all. You're not going to shock us. And everything you tell us is private. So just know it's a safe space. If you want to check out the full episode with Dr. Trotter and all her amazing pearls, be sure to click on the link here, and I will see you next week.